welcome to my channel. Thank you so much for joining me today. So my name is Joyce and I'm a physician associate in general practice, and in this channel we talk all things health and wellness. We talk about physical health, mental health, and I have recently started also doing videos about just me working out at home. So if this is something that interests you, if health is something that interests you, I think it should interest all of us. So let's just get right into the video. So today we are going to talk about a condition called peptic ulcers. So stay tuned. So what are peptic ulcers? So basically what they are is ulcers along your gastric tract. Remember, we are on the series with regards to gastric conditions. So sometimes you can get ulcers on the stomach or further down just below the stomach, which would be the duodenum. So you can have ulcers on there, and that's what this condition is about. In terms of risk factors or what causes someone to have ulcers, there are a few things that could cause ulcers. One is a bacterial infection from the H. pylori bacteria. Another is using NSAIDs, so non-steroidals like ibuprofen, naproxen, and others as well. Smoking can cause ulcers, as well as drinking excess alcohol, so excessive drinking. Stress can cause ulcers, spicy foods, and also if you have a family history of ulcers, peptic ulcers, then you could also have them because of that. What are the signs and symptoms of peptic ulcers? So one is nausea and vomiting, and you definitely would have a burning abdominal pain. Usually it's not always there, it's intermittent. You could have bloating, so stomach bloating, you could have burping, loss of appetite, and also weight loss. And you likely also might have dark, tarry stool. If you remember, if you have an ulcer in your stomach or duodenum and there is a bleed there, and as the blood is coming down the gastric tract, by the time you pass your stool, that blood has darkened. Okay, so in terms of trying to distinguish whether one has stomach ulcer or duodenum ulcer, with stomach ulcers, most people would say that they have pain shortly after eating, whereas with the duodenal ulcer, you are not likely to have pain after eating, but more likely to have pain when you're hungry. The other thing is, most people who have stomach ulcers would end up not eating as much because pain is associated with them eating, so they're likely to eat less, which then results in them losing weight as well. So when you come to your clinician and you tell them whatever symptoms you have, please bear in mind you most likely won't have all of the symptoms that I mentioned earlier. So your clinician will do some investigations. One, they will do blood tests, usually to check on inflammation and also if you are low on iron from the bleeding. And another test would be to check your stool for the H. pylori infection that I mentioned earlier. And in terms of management, it depends on what's causing the ulcer. So usually lifestyle is very key. So stopping smoking is one, stopping or reducing alcohol consumption is another, avoiding using the non-steroidals like the ibuprofen and the naproxen is another thing, and stopping spicy foods or reducing the amount of spices you have is definitely another way as well of improving with regards to that condition. Medication wise, you are likely to have antacids. So another thing would be proton pump inhibitors. So usually you source those from your doctor, your general practitioner, although sometimes you can get those over the counter. But I would strongly advise seeking medical help, medical advice before sourcing them until you know what's causing your symptoms. You might on the odd occasion have to have surgery. That is if all the other things that I've mentioned before have not worked. Okay, so in terms of monitoring, if you have, let's say you have the H. pylori infection, you would have the proton pump inhibitor, and also you would have antibiotics as well to eradicate that. And depending on your response, usually most people do respond well and there's no further antibiotic treatment, although you might have to carry on with the proton pump inhibitor until your symptoms are resolved. So I do hope you enjoyed this video. If you did, then you know what to do. You need to click like, share and subscribe. And if you know anyone else who has stomach ulcers, duodenal ulcers, please share this with them. They might find this useful, or they might get some insights which they didn't know before. Otherwise guys, I will check you on another video, and see you later. Take care.